Well, the Sinius unit is very easy to operate, and one of the key things we want to do is to keep it in the very basic mode. We turn the unit on by pressing the on-off switch. Wait till the beep goes. You do not need to continue pressing. The computer is doing a warm-up cycle, and that takes a few minutes. In the start program, we have our basic functions. The S is for when the patient needs to rinse, and this will activate the cuspidor. To get the chair into the entry and exit mode, we use 0. To get the chair into treatment position to work on the mandibular arch, we press 1. And to get the patient into the treatment position to work on the maxillary arch, we press 2. If you want to adjust the position of the chair, there are two main ways to do this. The first is to use the functions on the display. Using the chair icon, we press that, and then we can tilt the chair backwards, or forwards, or down, or up. We can also manipulate the chair by using the foot control. Pressing away, back, pressing to the right, up, down, down, and up, up. If you are trying to get the chair up and it doesn't work, an error will show on the screen. And the most likely reason for this is that the cuspidor is actually over the chair. Move it away, and you'll be able to use the chair up and down. This is a safety feature to help us prevent breaking the cuspidor. To turn the light on and off, we press the light button. Off and on. If we are doing composite restorations, we can press the light with the C on it. On and off. Another way to control the light on and off is to wave under the light. On, off. If you're in the normal bright mode and you want to use the composite light mode, you can hold your hand up under the light and it will change to the composite mode. Move your hand up again, it comes back to full light mode, and then off. On here we have a bell button. This is to request assistance from your tutor, and a red light will show up on the light arm. We have the cuspidor fill, and we also have the cup fill button, both on and off. If your patient faints, we have the emergency position. This lowers the head and raises the feet. We also have a timer button, so we can use a countdown if we want it for particular materials. When you pick up a handpiece, the panel changes to the instrument display mode. Here we can see the motor will be running at 40,000 RPM. We have an indicator for the water spray to be on, so off, on, off. Here we have two electric motors, and we have a red band for speed increasing, and we have the blue band, which is the slow speed. Okay, go. The spray vent tip has air on the left-hand button, water on the right, and you'll notice that it also has a light. And here we have the ultrasonic handpiece. And you can see that there are different power settings, 1 intensity, 50% intensity, or 100% intensity. On the dental assistant element, we have the slow suction, the high volume suction, the spray bit, and the curing light. On the right hand side, we can see the same buttons. 1 for the rinse mode, S, 0 for the entry-exit mode for the patient. We have light modes, composite curing light mode, or normal light mode, or off. We have cuspidor filling, and we have cup filling. When the handpieces are all fully placed, using the foot pedal, we have the letters S and 0. Similar to the control panel, if I press S, the chair is returned to the rinse mode. Or if we press 0, the chair is returned to the entry-exit position of the chair. When I pick up the handpiece in the instrument mode, these buttons change. We can see on the left-hand side there is a spray, and this is the water on-off button. Currently it is off. I press it once, it is now on, and I can press it off again. On the right-hand side, there is a air chip mode. By pressing this, we force air through the handpiece, but no water. This is very useful when you're doing a preparation on a tooth, and instead of picking up the triplex, you can now use the handpiece to blow air and to remove water from the tooth. Between patients, we'll be using a cleaning product on the chair. This will be probably in a foam mode, and we'd wipe down the chair. Between patients, it's important to purge the water lines. We don't want any backflow of any bacteria. So in order to do this, we come to the main menu. You press the button on the lower right, and if we look at the top left, this is the handpiece purge mode. We press start. We take the handpieces over the cuspidor, and we then press the start button on the panel. This will now purge the handpieces. The water lines are being cleaned. Finished purging, the icon indicates the handpieces are ready to go back onto the cart. It would now be appropriate to take off the handpieces in preparation for returning to the instrument return bay. Between patients, it's also important to flush the high and slow suction. Place onto the chair. It doesn't matter which orientation you have, whether it's this one on there or that one on there. Press the green button, and we start allowing fluid to suck back through the tubes and clean them. Once you've heard the beep, now you can remove the tubes and reposition them on the tray. You would now go through a wipe down procedure for each of the tubes. It's also important to purge the spray bit tip on the assistant side, pressing and holding the right hand side. Allow that to flush through for about 20 seconds. And you'll do the same for the dentist spray bit tip as well. At the end of the day, we need to clean the whole unit. The easy way to get the cover off the spray bit tip is to press the blue button. Remove this completely. All other hand pieces should be removed, including the ultrasonic. So at the end of the day, for the cleaning procedure, we now press the sub-menu button, and in the middle here we have the auto function. I'm going to press the auto function, and then I'm going to press the start function, and now we bring the tubes across onto the side of the chair. Keep the silver side up, place it into the yellow. The electromotors go into the blue. If you had an adapter on the high-speed line, you would also insert that, but we haven't used this one, so we don't need to. We have the ultrasonic line, which this is a bit delicate, and you have to very carefully give it a little bit of a twist until it locates. Now, on the dental assistant side, we will be placing the high and slow vacuum into the side of the chair. We would also be bringing the spray vit tip. We need to remove the cover. Similarly, keep the silver upwards, place it into the yellow carefully until it's fully secured. Now we go back to the dental element and we press the start button. This is now a deep cleaning cycle, which will take quite a few minutes. So that cleaning cycle has taken quite a few minutes, and once it's complete, it'll tell you we can bring the handpieces back to the chair. Probably the best thing at night though is to leave it all connected to the chair and just simply turn the unit off last thing, wait for the beep, turn the chair off, but leave all the hoses connected overnight. This means that the first thing you need to do in the morning is to turn the chair on, and it will go through its purge cycle again.